an agency with a heart for every Filipino, a home of technical experts on health, an executive department that provides and ensures quality health services for all. This is the Department of Health. For the past years, the DOH has been and always true to its promise in prioritizing the welfare of its people through the hard-working men and women of the department. Long before, the DOH is considered as pioneer in serving the people by becoming one of the earliest executive branches to be established in the country. Since 1898 to 1908, during Spanish and American periods, public health has been a priority. One of the highlighted accomplishments during these times was the introduction of the vaccine for smallpox, also called bulutong, that was used against the epidemic that spread nearly the whole country. On June 23, 1898, after the proclamation of Philippine independence from Spain, the creation of a military National Department of Public Works, Education and Hygiene was proclaimed. Then, Board of Health for the City of Manila was created and later reorganized to include the registration of births, deaths, and marriages. Through Act No. 157 of 1901, the Board of Health for the Philippine Islands was formed, which functioned also as the local health board for Manila. Later, it was replaced by Bureau of Health under the Department of Interior. In 1908 to 1918, the Bureau of Health became Philippine Health Service, that introduced a systematic organization of personnel with chiefs of division, deputy chiefs, medical inspectors, and senior surgeons. Later on, through the Jones Law, the Public Health Law of 1917 was created. During 1918 to 1928, although there were challenges to face in terms of diseases and manpower that needs to be addressed, the Philippine Health Service did not stop from serving the people. In fact, health and puericulture centers for the education of mothers regarding personal hygiene and sanitation was put up. In the same decade, through Act No. 3029, on March 8, 1922, the Philippine legislature mandated the health examination of all school children at least once a year. From 1928 to 1938, the following were accomplished. A major reorganization in public health administration that made it more aggressive towards public health and social work. Establishment of Bureau of Health through Act No. 4007 with 5 divisions: hospitals and dispensaries, sanitations, epidemiology, child and maternal hygiene, and administration. Involvement of private sector and practitioners in matters of public health to inform the greater public about health care. New strategy to curb tuberculosis. Setting up of traveling X-ray clinics, pavilions, and government facilities for mental patients, and a school for children with mental disabilities. Deployment of traveling clinics to provide medical care for those living in far-flung and remote areas. In 1938 to 1948, the Department of Health and Public Welfare was created by virtue of the Commonwealth Act 430. It was tasked with the protection of the health of the people, the maintenance of sanitary conditions, and the proper enforcement of health laws, sanitation, and social services. In 1948 to 1958, the Philippines has finally earned its sovereignty. The separation of the country's health and public offices through Executive Order No. 94 was enacted. Then, the Department of Health was born. It was structured to be in charge of all city health offices, the Bureau of Health, the Bureau of Quarantine, and a new division, the Bureau of Hospitals. In the 1950s, the relocation of the World Health Organization regional headquarters for Western Pacific from Hong Kong to the Philippines happened. One of the successful partnerships with international organizations was when BCG first introduced in the country and mass vaccinations were jointly undertaken by UNICEF and DOH. Up to this day, BCG remains to be part of the national immunization program of the country. In 1953, the flagship program for health was establishing a clinic in every municipality, which was executed through the Rural Health Unit Act of 1954. There were about 81 RHUs established in the different provinces then to implement basic health services such as maternal and child health, environmental health, communicable disease control, generation of vital statistics, medical care, health education, and public health nursing. During the decade of 1958 to 1968, the decentralization of health services and the creation of 8 regional health offices was made possible through the creation of regional health offices via Executive Order 288. It was signed with the goal of bringing health care closer to the people. It was also during this time that the first National Health Insurance Plan was presented to the Congress. Among the achievements during this decade were the passage of Republic Act 3720 or the Food, Drug, and Cosmetics Act, the creation of National Water and Air Pollution Control Commission through Republic Act 3931, and National Schistosomiasis Control Commission was instituted by virtue of Republic Act 4359. In 1968 to 1979, one of the definitive moments of the decade was the passage of a landmark bill that provided health care for Filipinos, the Philippine Medical Care Act of 1969, also known as Medicare. At the end of this decade, the creation of the Population Commission through Executive Order 171 brought to light the urgency of population management. During the time of martial law in the country, the following were achieved: the classification of health services into primary, secondary, and tertiary levels after restructured healthcare delivery system was initiated. The creation of barangay health stations to support primary health services through Rural Act of 1954. And the launching of Rural Health Practice Program in 1976 that fielded new doctors and nurses to serve in rural areas for a period of 3 to 6 months. During the decade of 1978 to 1988, the Department of Health was transformed into Ministry of Health. In 1979, a specialty medical facility for children was built, the Philippine Children's Medical Center or PCMC. In fact, through Proclamation 1605, the years 1977 to 1986 were officially proclaimed the Decade of the Filipino Child. The year 1986 marked the restoration of democracy that began with the people power. One of the first acts during this time was the issuance of Executive Order 119, which marked the return of the Department of Health from the previous Ministry of Health. The signing in October 1986 of Executive Order 51, commonly referred to as the Milk Code, which aims to ensure safe and adequate nutrition for infants through breastfeeding. Another landmark bill that was signed was Republic Act 6675 or the Generic Drug Act, mandating physicians to prescribe generics as well as branded options to patients. This law gave access to affordable medicine. In 1988 to 1998, 2 other pieces of legislation were passed: Republic Act 7160 or the Local Government Code of 1991, which ushered in the devolution of services not only for the DOH but other government agencies as well. Another was the long-delayed implementation of 20% discount on hospital and laboratory fees in government facilities for government employees as well as their immediate family members. This privilege was stipulated in Republic Act 747, which was enacted way back 1952. In 1992, Magna Carta for Public Health Workers, or Republic Act 7301, was passed to provide benefits for the health workers. In the field of nutrition, Republic Act 8172, also known as the Asin Law, was passed to combat iodine deficiency disorder by mandating that all food for human and animal consumption be iodized. Through the National Blood Services Act of 1994, the National Voluntary Blood Services Unit during this decade was created. This decade, the Republic Act 7170 of the Organ Donation Act of 1991 was amended by Republic Act 7885. It is otherwise known as an act to advance corneal transplantation in the Philippines. Another accomplishment was the passage of Republic Act 787, or the National Health Insurance Act of 1995. It was a turning point in history of Philippine public health care and considered as fulfillment of a vision for a more equitable healthcare system for the coming years. During 1998 to 2008, establishment of the Integrated Reproductive Health Program took place. It was grounded on 10 elements that include family planning, adolescent reproductive health, and the prevention of violence against women was rolled out. One of the accomplishments during this decade was the establishment of Botika ng Bayan, which aims to improve access to quality health care and establish stronger partnerships with LGUs and community organizations. Additionally, Republic Act 8423, or the Traditional and Alternative Medicine Act of 1997, was signed into law. This law champions and protects the knowledge of indigenous societies with regard to the practice of traditional medicine and supports research in the development of alternative cures. Meanwhile, the Executive Order 102 was signed to redirect the functions and operations of the Department of Health to the local government units. Another noteworthy accomplishment in this decade is the Republic Act 9211, or an act regulating the packaging, use, sale, distribution, and advertisement of tobacco products and for other purposes was passed. 2008 to 2018. Up to this time, the DOH have proven its mandate to continuously serve and care for the Filipino people. In fact, during this decade, passage of more major accomplishments were made. Republic Act 9502, Accessible, Cheaper, and Quality Medicines Act. Enactment of the Food and Administration Law. Expanded Senior Citizens Act. Mandatory Infants and Children Health Immunization Act. An act restructuring the excise tax on alcohol and tobacco. Responsible Parenthood and Reproductive Health Act, National Health Insurance Act, and Food Safety Act. An act to effectively instill health consciousness through graphic health warnings on tobacco products. Responsible Parenting and Reproductive Health Law. Finally, in the year 2017, another milestone of the department was the passage of Executive Order Number 26, or providing for the establishment of smoke-free environments in public and enclosed places, and Executive Order Number 28, providing for the regulation and control of the use of firecrackers and other pyrotechnic devices. Recently, the government established the TRAIN Law. This law provides and supports the DOH on the following: increase in taxes for cigarettes and sugar-sweetened beverages, promotion of healthy lifestyles, and the prevention and control of non-communicable diseases. Lowering the prices of medicines by exempting from the 12% VAT all medicines used for diabetes, high cholesterol, and hypertension. Learnings and changes, challenges and improvements, difficulties and attainments, hardships and progress. Through all of these, the DOH remained standing still and continuously championing the health for our people.